When is it time to stop driving? It's an important question that many seniors will eventually have to face, but one that they may not want to think about. After all, being able to drive provides independence, mobility, and access to things like friends, family, and medical care. But as people age, their health can change, which can make driving more difficult or even dangerous in some cases. We're here to help with this tough decision. In this video, we'll look at some reasons why your senior loved one might need to consider stopping driving and some tips for making the transition easier. Before we jump into it, please subscribe to our channel for more videos on senior living. Let's dig in. Vision changes. Vision problems are one of the most common reasons for seniors to stop driving. According to the National Institute on Aging, several vision conditions are more common in older adults, including cataracts, macular degeneration, and glaucoma. These can all affect a person's ability to see while driving, which makes it much more dangerous. But it's not just about what you can see. Vision changes can also affect how well you can react to what's on the road. According to the American Academy of Ophthalmology, your pupils also have less ability to adjust to different amounts of light, making it harder to see when going through tunnels or in bright sunlight. And as people age, their depth perception can diminish too. That means judging distances between cars or while parking can become trickier. If your loved one is having trouble seeing while driving, it may be time to consider stopping. The good news is that there are plenty of other transportation options available. Many communities have public transportation systems that can help seniors get where they need to go without having to drive themselves. Ride-sharing services are another great option, as they are usually available at a moment's notice and can take your loved one almost anywhere they need to go. You can also look into local senior transportation programs, which often offer discounted or even free rides. Medical conditions and medications. Another reason a senior might need to stop driving is due to a medical condition or medication. As people age, they're more likely to develop conditions like dementia, Parkinson's disease, and diabetes, all of which can make driving more challenging. For example, according to the Alzheimer's Association, those with dementia may have trouble following traffic signs and signals or remembering how to get home. People with Parkinson's disease may find it hard to control their vehicle due to tremors or other movement problems. And diabetics may need to pull over if they experience low blood sugar while driving. In addition, some medications commonly taken by seniors can also impair driving ability. For example, sleeping pills and anti-anxiety medications can cause drowsiness, while muscle relaxers and pain relievers can slow reaction times. If your loved one is taking multiple medications, it could also increase their risk of becoming drowsy while driving. This is called the polypharmacy effect and occurs when the combination of multiple drugs leads to unexpected side effects. It's important to talk to your loved one's doctor about any concerns you have regarding their medical conditions and medications, and whether or not they should continue driving. If you're worried about your loved one's ability to drive safely, you can also ask their doctor to perform a cognitive screening. This is a quick and easy way to assess your loved one's mental capacity and determine if they are still fit to drive. The 4 signs of physical impairment. There are certain physical impairments that can make it difficult or dangerous for a senior to continue driving. This includes things like arthritis, which can make it hard to grip the steering wheel or turn the car. Key vision problems, as we mentioned earlier, or hearing loss, which can make it tough to hear sirens or other warning sounds. Seniors who have had a recent stroke or have balance issues may also find it difficult to control the vehicle or quickly react to what's happening on the road. It's important to note that even if a senior has one of these impairments, it doesn't automatically mean that they can't drive. It's up to the individual to decide whether or not they're still safe behind the wheel. However, if you're concerned about your loved one's physical abilities, you can ask them to complete a driving test with a qualified instructor. This can help you get an objective assessment of their skills and identify any areas that need improvement. The last 4 years, so far we've talked about various health issues that can affect a senior's ability to drive. However, there's also a specific age that you should keep in mind when deciding whether to stop driving. According to the CDC, people over the age of 70 are more likely to be involved in fatal crashes than younger drivers. This isn't because older drivers are necessarily worse behind the wheel. Instead, it's because, as people age, they tend to experience more physical and cognitive impairments that can make driving more challenging. This is why it is a good idea to reevaluate your loved one's driving ability every few years, especially after they turn 70. You can also look into driver refresher courses, which are offered by many local driving schools and senior centers. These courses can help older drivers brush up on their skills and learn about new traffic laws and technologies. Plus, they may also receive a discount on their car insurance for completing the course. In addition to these factors, it's also important to consider the roads and traffic in your area. If your loved one lives in a busy city, they may feel more comfortable driving during off-peak hours when there's less traffic. But if they live in a rural area, they may have no choice but to drive during rush hour. Ultimately, it's up to each individual senior to decide whether or not they are comfortable driving in their area. Making the decision, if it's time for your loved one to stop driving, it's important to do it safely and gracefully. First and foremost, they need to know that you redoing it for their own good and that you not trying to take away their independence. You can start by talking to your loved one about their driving ability and any concerns you may have, then work together to come up with a plan that works for everyone. This may involve setting some ground rules, like only driving during daylight hours or in familiar areas. You can also help your loved one explore alternative transportation options, so they not completely reliant on driving. It's also important to be patient and understanding during this time. Your loved one may feel like they're losing a part of their independence, so it's important to be sensitive to that. Be supportive and reassuring, and let them know that you're there to help them through the transition. If you're worried about your loved one's safety or the safety of others on the road, don't hesitate to contact their doctor or the police for help. They may be able to provide resources or assistance that can make the process easier for everyone involved. While it's not always easy, ultimately, the decision of when to stop driving is up to the individual. By following these tips, you can help your loved one make a safe and smooth transition off the road. We hope this video was helpful. If you're looking for more information on how to support a loved one who's aging, check out our blog. Thanks for watching.